Hello, my name is Tom Buckley from the University of Delaware, and on behalf of my co-authors, I'd like to present our article entitled Lower Extremity Musculoskeletal Injuries After Concussion in Collegiate Student Athletes. This article was published in a February edition of the American Journal of Sports Medicine. So what do? We examined the records of over 30,000 NCAA student athletes from the Injury Surveillance Program over the last decade, ending before COVID. The enrolled athletes for the study all experienced at least one injury, and we broke the athletes down into two groups, either football players or all other sports combined. Statistically, we used multivariate logistic regression to examine the odds of lower extremity musculoskeletal injury, time loss lower extremity musculoskeletal injury, and non-time loss lower extremity musculoskeletal injury following an initial injury, either concussion or musculoskeletal, in a single athletic season. So what do we find? Overall, there was no elevated risk of subsequent lower extremity musculoskeletal injury in either the football or other sports group. There was, however, a lower risk of time loss musculoskeletal injuries and an increased risk of non-time loss musculoskeletal injuries in football players, but not in other sport groups. So what does this mean? Previous cohort-based studies have routinely identified 2 to 3 times elevated risk of post-concussion musculoskeletal injury over 1 to 2 years. However, the results of this study did not support these prior findings, as we did not find an elevated risk of injury in the same season. Interestingly, there was the decreased risk of time loss musculoskeletal and increased risk of non-time loss musculoskeletal injury following concussion in the same season. Moving forward, we need to continue working on identifying which student athletes are most at risk for post-concussion musculoskeletal injury and consider implementing established effective injury risk reduction programs.